My name is Samson Samuel. I'm a practicing hand surgeon and a plastic surgeon. And this video highlights the importance of some of the steps you have to take in order to prevent wrong side surgeries. Organizational development and change was usually applied to industrial and manufacturing sectors, which has produced efficient organizations and also has improved performance of the industry. This concept has been introduced in healthcare sector, and it has made remarkable progress in terms of achieving organizational effectiveness and preventing some of the medical errors that commonly occurs in healthcare industry. One of those things was wrong side surgery. As we normally see, occasionally see, doctors performing surgery on a wrong finger or a wrong eye or taking out a wrong limb or wrong kidney. These errors are preventable. This video highlights the importance of series of steps you need to take, which I have implemented in my practice to prevent and to eliminate wrong side surgeries. This is my office, and patient walks into the clinic or the office, and I do the diagnosis, examination of the patient, and make a diagnosis based on history, physical examination, and other diagnostic studies. After this, I will explain to the patient about the various treatment options he or she got, including the surgical option. The example I've taken in this video is a patient coming with carpal tunnel syndrome, and I'll be performing a right carpal tunnel release surgery. This is one of the office rooms, and patient sits in the corner, and I examine the patient. Once the patient agrees for the surgery, I discuss with the patient about the risk benefits of the operation, including the outcomes and the expectations, and informed surgical consent will be obtained. And this is the consent form, which will be signed by me and also by the patient, witnessed by a medical assistant. And after this consent form is obtained, the medical assistant takes this form and faxes the form to the boarding office in the hospital with all the information about the patient, the diagnosis, the procedure, the course, and the information is faxed to the boarding office. Hi, this is Dr. Samuel again. I'm in the operating room now, the patient walks and comes to the front desk where the registration is performed of the patient. Patient gives his ID and it is checked by the front desk people. This was followed by some paperwork needs to be done, and once that's done, the nurse from the pre-op holding area will bring the patient to the holding room here, and the nurse takes all the essential information about the patient, and then confirms the site, type of surgery, and confirms the patient's name, social security number, age, with the fact sheet that was done from the clinic. Once that is done, the patient changes here, and I, being the surgeon, I go to the patient, I talk to him or her, and once that's done, I will ask whether the patient has got any questions about the surgery, and the risks or complications will be explained again. And once that's done, patient is going to be having right carpal tunnel syndrome. So I will mark my signature on the hand where the surgery is being performed. I will, in fact, in some patients, I even draw the surgical incision in this area. Now, once that is done, the anesthesia will come in, and they will give the anesthetic. Once that is done, the patient will be ready to go to the operating room. The nurse will come in and will take the patient on the gurney, and we'll be going to the operating room now. This is the operating room where the patient will be brought in. Patient will be placed on the operating table. That's the anesthesia machine. And once the patient is positioned, there will be, when the patient is ready to have the surgery, the surgeon will come in and a timeout will be done. The surgeon will say the name of the patient and also the procedure that's going to be performed. And in this case, I'm performing the right carpal tunnel surgery, and everybody, including the anesthesia, the circulating nurse, and scrub tech, will all okay it, and the consent will be verified by the surgeon and also by the circulating nurse. And once that's been confirmed, then the surgery starts. So it's very important that the timeouts are done in the operating room in the presence of the surgeon and all these surgical team in the operating room to once again confirm the site and the procedure that will be performed on the patient. Now, once that is done, the surgery will be completed and the patient will be back to the recovery room. Now, these are the various steps we take to prevent wrong side surgery. The first point is scheduling, which is be scheduled in the clinics or in the office. where the consent form is obtained. The appropriate procedure along with the site where the surgery will be done will be documented. That will be faxed to the hospital boarding room, and the boarding room, the surgical team here will verify or reconcile with the various information that's been provided about the patient. On the day of the surgery, the patient walks in, and the patient in the pre-op holding area, the surgeon will mark the site where the surgery will be performed, and will confirm the type of surgery. And in the operating room, timeout will be performed, wherein the surgeon and the circulating nurse and the anesthesia crew will confirm the procedure and the site. Once that is done, the surgery is performed, then the operating room turnover takes place for the next patient. So wrong side surgery prevention or elimination is very important for an organization. So organizational commitment is extremely important. Education of the surgical staff and also the physicians is very important, which we have adapted in this institution. And evaluation and feedback from the patient and from the crew, from the surgical team, will also help to have a lasting effect of preventing the wrong side surgery. So in summary, I would like to provide these various stages or various steps that one has to take prevent wrong side surgery, and it's extremely helpful to have an improved quality of healthcare and patient satisfaction, and also organizational effectiveness improves by adapting these methods. Thank you.